Welcome to TPMG Health Talk. Join us for valuable insights and practical advice on health topics that matter to you most, delivered by our top medical professionals. At Tidewater Physicians Multi-Specialty Group, we're dedicated to providing high-quality, physician-directed care to the Hampton Roads community. Subscribe now and visit mytpmg.com for more resources. Now let's dive into today's episode. I'm excited to introduce today's guest, Dr. Tharini Gunapalan. She is a board-certified internal medicine and endocrinology physician with TPMG Coastal Endocrinology in Suffolk. She completed her Doctor of Medicine at Ross University School of Medicine and went on to complete her residency and fellowship in endocrine and metabolic disorders at Eastern Virginia Medical School. With a special interest in diabetes and thyroid disorders, Dr. Gunapalan is passionate about patient education and collaborative evidence-based care. Thank you for joining us.
Happy to be here. Thank you for having me.
When we discuss endocrine health, we're covering conditions like thyroid disorders, diabetes, and other factors that influence your body's balance. Thyroid conditions specifically can be under-recognized, yet have a significant impact if not managed properly. Dr. Gunapalan, what are the most common signs and symptoms of thyroid disorders, and what should patients look out for?
Great question. So symptoms of thyroid disease vary drastically depending on the type of thyroid disorder you may be dealing with, whether that's low thyroid function or high thyroid function. But I think first and foremost, it's important to understand that our thyroid plays not only a large role in our overall health, but in particular our metabolism. So oftentimes patients may notice unintentional changes in their weight, temperature intolerances, changes in their bowel habits, sleep patterns, and fatigue. And in more severe cases, we can see, muscle weakness, heart conditions such as arrhythmias, and fluid retention. There are additional signs and symptoms that may not be as common, but can certainly be due to a thyroid disorder. It's important that you address any and all concerns that you may have regarding a potential thyroid disorder with your primary care provider or an endocrinologist if you're seeing one, so that further workup can be done.
How do you know when to see an endocrinologist versus going to your PCP? Because what if you don't have one?
It is definitely important to have a primary care provider because thyroid disorders, the symptoms can be very similar to other conditions. And so having a primary care provider, you get kind of a full workup, not just focused on the thyroid. So they'll look at other disease processes as well. But, it's not always easy to find a primary care doctor. So, you're always welcome to try and establish with an endocrinologist if you have some genuine concerns regarding your thyroid or diabetes or what it may be. And even if you do have a primary care provider, they can start the initial workup and refer you to see an endocrinologist. Or you can go about making that appointment yourself if you feel like you need some additional information.
When a patient comes to you with symptoms of a thyroid issue, how do you approach diagnosing and creating a treatment plan?
So first, I like to get a thorough medical history, including discussing their current and past medical conditions and their treatments. Because thyroid disorders, although common, can present with very similar symptoms to other conditions and can also worsen other medical conditions if they're left untreated. I then dive into the specific symptoms that they have been dealing with that they feel may be concerning for a thyroid disorder. And then I review any and all blood work or imaging they may have recently had done. If they have not had any recent lab work, then I'll order that, or I may order more detailed lab work to figure out what's going on. Sometimes I also perform a thyroid ultrasound at that visit. I find it very helpful in understanding what may be going on in the background. Lastly, I think it's important to discuss with my patients what their goals and expectations are moving forward. If they are diagnosed with a thyroid condition, what the short-term and long-term course may look like. I often also see patients who have already been diagnosed with a thyroid condition, but are seeking more help in better treatment options or even just better understanding the disease itself. There is a ton of information online, but it's important to focus on research and evidence-based recommendations and treatments, and that's why it's important to see a trained medical professional to get that education. And, if you have questions from things that you've read online, you should feel comfortable to ask those questions to your provider.
Now, are there any lifestyle factors or treatments that can help manage thyroid conditions effectively?
So for the most part, we can't control whether we develop a thyroid disorder, but we can take control of how effectively we manage it. So keeping a routine follow-up with your medical providers, taking the medications as prescribed, and monitoring your thyroid levels when recommended is very important. Also, patients shouldn't hesitate to reach out to their providers if they start to develop new symptoms that they feel may be related to their thyroid or are concerned regarding their current treatment plan. It is not unusual for your treatment plan to change over time, whether it be adjustments to your current thyroid medication dose or changing to a different medication altogether. I always recommend being proactive and advocating for your health whenever possible. And of course, maintaining a healthy lifestyle is always recommended, regardless of whether you may be dealing with a thyroid condition.
Now, as you mentioned, thyroid medication requires a strict routine. Does the timing of thyroid medication really matter? Is it really true that it needs to be taken at the same time every day and that it can conflict with caffeine? I know specifics can vary.
Yes. Yeah, no, it really does, especially when you're on thyroid replacement such as levothyroxine. I like to joke sometimes that this medication is very picky. It doesn't like to share space with anyone, and it likes to just be on its own. So the recommendation is that it be taken first thing in the morning on an empty stomach with only water and wait an hour before breakfast, coffee, or other medications. And the reason being is that thyroid replacement is often not absorbed well if it's taken with food or medications. So you may not actually be getting that full dose, which ends up translating to less effectiveness of the medication and less improvement in your symptoms.
We have an episode with Dr. Parisi, our sleep specialist in Williamsburg, where he discusses shift work routines, and taking medications at the exact same time can be really challenging for people working unconventional hours.
Yeah, I come across that a lot. I do have some patients who work night shifts, for example. So their schedule is, the complete opposite. So I think it's important to know that you don't necessarily have to take it first thing in the morning. So if you're working nights, for example, and your schedule is switched, the most important part of it is that you need to be in a fasted state. So if you're sleeping during the day and you wake up for your shift in the evening, you have fasted, I would assume, for, several hours, then it would be safe to take it then. But then you do have to wait, ideally an hour before eating your first meal and taking other medications. So, I definitely work with my patients in coming up with a routine that's suited for them and make sure that they're properly absorbing the medication at the same time.
Now let's talk about diabetes, one of the most common endocrine conditions. And managing diabetes involves more than just addressing the basics. While every patient's experience is different, there are some common challenges people with diabetes and their caregivers face. Can you share some of these recurring struggles and how they can be addressed in care?
Sure. I think that's a very important question. I think the first struggle, and likely the most important one, is knowing when to seek help. Diabetes is very much a silent disease, meaning most people don't have any symptoms or indications when they are experiencing high blood sugars. Oftentimes, it is diagnosed after routine blood work or once it's severe enough that you are starting to experience symptoms such as unintentional weight loss or frequent urination. And by that point, blood sugars have been quite high for some time. So it is very important that you be screened for diabetes if you carry risk factors such as obesity or high blood pressure or high cholesterol, or if there is a strong family history of diabetes. And then even after diagnosis, it can be difficult to manage, as again, it very much is a silent disease. So when people feel fine, it can be hard to wrap their head around making a huge lifestyle change. And whether that be monitoring their blood sugars, changing their diet, or starting new medications. So I think it's important to meet patients where they are, help them understand the disease better, and why making the changes that are recommended will have long-term benefits for them. There's also a term called diabetes burnout, and I see that all too often. Patients are just tired of having their lives revolve around diabetes, and it really shouldn't have to be that way. So creating a manageable plan that they feel they can handle can make all the difference, and reaching out and speaking to others with diabetes can really help them understand that they aren't alone in these struggles.
What are some tools or resources you recommend for patients who are having difficulty staying on track with their diabetes management? And what sustainable changes can they make to their diet and exercise routines to better control their blood sugar levels?
I think first and foremost, it's important to find a diabetes provider that you feel comfortable with and you trust. This really is the backbone to achieving the best results. If you feel you are struggling with managing your diabetes, you should feel comfortable voicing that concern to your provider. We're also in a time now where we have so many treatment options for managing diabetes, and there isn't just one cookie-cutter treatment plan that will fit everyone. Your diabetes treatment plan should be tailored towards the goals that you and your provider put forth together. I also very much advocate for diabetes education classes. It's an opportunity to view and understand diabetes as a lifestyle change rather than a chronic disease, and they often can be done in group classes so you meet others who are also dealing with it. And as it pertains to diet, really any improvement you can make with your diet, whether that's improving the quality of the food you're eating, lowering the intake of simple carbohydrates, avoiding frequent snacks during the day, or decreasing the frequency of which you eat out at fast food restaurants, you will certainly see instant improvement in your blood sugars. And exercise isn't always easy to fit into your daily schedule, but even 10 to 15 minutes of cardiovascular exercise can improve your diabetes control tremendously. And you can lower your blood sugars for even up to 24 hours after a workout by making your body more sensitive to insulin. Also, routine is key. So once you create a diet and exercise plan and stay consistent with it, eventually it becomes part of your lifestyle and it feels much less of a hassle. Also, whether it is joining a gym, starting a sport, or even just going for a walk, doing it with others really helps improve motivation and accountability. So try and find a friend who's already ready to make a health and lifestyle change and do it with them.
An accountability partner. I like it. Now, something that I've heard is people in their family getting diabetes later in life. They're afraid to get it later in life. Is that common?
It is common, especially if there's a strong family history of that. We are seeing now that people are getting diagnosed at younger and younger ages. And I don't know if that's the lifestyle changes, more stress, diet, or what other factors could be playing into it. So, having a primary care provider is key because they'll know when the right time it is to screen you for diabetes. And if you feel concerned, you're more than welcome to, talk to them and see if you should be screened sooner rather than later.
Hormonal imbalances can affect everything from metabolism to mood. What are some most common hormone imbalances you treat at Coastal Endocrinology, and how do you determine the best course of treatment?
As an endocrinologist, I see a wide range of hormonal conditions, ranging from thyroid to pituitary to adrenal to parathyroid to PCOS, just to name a few. I also see patients for bone and mineral disorders such as osteoporosis. Treatment, again, is really geared towards symptom resolution as well as the severity of the disease that I may be treating. So, for example, let me talk about PCOS real quick. So, PCOS is a very common and often underdiagnosed condition in women. So, my job as an endocrinologist is to solidify the diagnosis by ruling out any other possible conditions that could be mimicking the symptoms of PCOS. And once we have our diagnosis, discuss the treatment options. Because PCOS can present differently for every woman, one symptom that is bothersome for one person may not be bothersome for another. So I target the treatment to their specific concerns. And just like with PCOS, it's common with other, endocrine conditions as well.
Now, are there any misconceptions that you often encounter related to hormone imbalances or treatments that you'd like to clarify for our listeners?
Every hormone in our body has a very specific and important job, and they're constantly changing minute by minute, second to second, and often working in conjunction with one another to ensure our bodies are running as it should. Because of that, I think it's also important to point out that timing is key. Because certain hormones are constantly changing, you want to make sure when their levels are checked, they're done at the appropriate time, as that can make all the difference in whether you may have a true hormonal problem or not. Also, other medical conditions can affect how well your hormones work. So it is important to continue to properly manage any other medical conditions and be screened for other medical conditions as recommended by your primary care provider.
Before we wrap up this episode, Dr. Gunapalan, is there any advice you'd like to offer our listeners who believe they are experiencing endocrine-related issues but are unsure where to start?
Yeah, definitely. So, it's very easy to access medical information now, whether that's through the internet or social media. But like I mentioned before, they're not always research or evidence-based, and then it can end up leading to more worry and more unanswered questions. So please don't hesitate to reach out to your primary care provider or endocrinologist. Hormonal disorders and diabetes can be managed better when they are properly diagnosed, and a treatment plan can be tailored to each person based on their specific concerns and goals.
Thank you so much. What got you into the field of endocrinology, Dr. Gunapalan?
That's a great question. I've always been fascinated by hormones. They're constantly changing, and they can make you feel great to making you feel horrible. And they work together, and sometimes they work alone. And so understanding the whole physiology behind it really fascinated me. And I've also had, a special interest in diabetes. It's such a common disease, and the treatment options now are so different than it was just 10 years ago. And there's more and more research coming out and treatments that are being offered that could really change the game for diabetes. So I think it's a great time to be an endocrinologist and, spread that information and try and lower the risk of diabetes. And in those who do have diabetes, make it a manageable disease that isn't taking over their life.
Well, thank you for sharing your expert insights with us today. And a big thank you to those of you who tuned in to this episode of TPMG Health Talk. At TPMG, we're committed to supporting you with a team of skilled and experienced doctors, all working together to help you achieve your best health. If you have any questions or would like to learn more about TPMG and how we can support your health journey, be sure to visit mytpmg.com for more resources and information. Take care.
The information shared on today's podcast is not intended to be medical advice, nor is it meant to replace a professional consultation with a healthcare provider. The opinions expressed in this podcast do not necessarily reflect those of TPMG or its providers and physicians.